So now on to the presentations. I'm going to invite, as I said, we'll have 4 presentations for 4 projects, and I'm going to invite our first team up, William Giroux and Brittany Supernaut.
All right. Well, good afternoon. So before we dive into the work that we did with the Baptist Health Y Healthy Living Centers, I have a couple questions for y'all. So just by a show of hands, who here feels that they get enough sleep every night? Okay, thank you. You can put your hands down. Second question for you, who here feels like they eat a healthy, nutritious breakfast every day? Okay, a couple more people there. Great. Third question, last question, who here feels like they exercise as much as they should every day? Okay, great. Some more hands. So thank you for your honesty. There's no shame if you raised your hand or if you didn't. My hand was only raised because I'm presenting. So the reason I asked those questions is because that's the type of thing that the Baptist Health Y Healthy Living Centers are focused on. They are community wellness centers, which are partnerships with the local YMCA centers. So they are within the local community of Jacksonville, and people can go there. It's open to YMCA and non-YMCA members to learn how to have healthy living habits. They are focused on wellness of people. They're not focused on treating diseases as much, more so making sure that people achieve their life goals and live healthy lives in general. Specifically, one of the things that they are focusing on is metabolic syndrome within the community. Now, metabolic syndrome is a cluster of symptoms that are associated with chronic health diseases such as type 2 diabetes and heart disease. So these 5 risk factors that you see up on the screen are the 5 factors that are considered to put people at risk for metabolic syndrome. And these are determined by the CDC at a national level. And so if you have 3 of these 5 risk factors, you qualify as having metabolic syndrome. So why focus on metabolic syndrome? When looking at the cost of healthcare in general, metabolic syndrome patients tend to spend $2,200 more per year on healthcare than those without metabolic syndrome. But the real problem lies in what comes after you develop metabolic syndrome. So because metabolic syndrome leads to type 2 diabetes and other health conditions, it's important to consider those costs. On average, people spend $3,400 more per year if they have metabolic syndrome than those who do not have metabolic syndrome. Now, considering that Duval County has 11.3% of its population as diabetics, if a portion of those are a result of metabolic syndrome, you're talking about a problem that costs Duval County hundreds of millions of dollars per year in healthcare. So, I'm going to explain a little bit about what the Baptist Health Y Healthy Living Centers do to help address metabolic syndrome and also help people achieve those goals. So I'll give you an example and walk you through the process of what that might look like for an individual. So the Riverside location gave us the story of one of their clients who came in and was referred by a doctor. So she signed up online, so that's step 1. They have to reach out and seek the healthy living centers on their own, or be referred by a doctor and then seek them out. And then after that, she took the personal health survey, and that survey recorded general information that the individual has, and then she went and took a health screening that got some information on her biometric data. And then after all of that, this individual met with a wellness coach, and that wellness coach was able to ask her, what are your goals? What do you want to do? Why are you here? And also look at the biometric information. For that individual, she wanted to be a runner. She wanted to finish a 5K. So the wellness coach was able to advise, okay, well, what are your eating habits like? Here's what and then the person didn't know exactly what she should be eating or shouldn't be. So the wellness coach was able to say, well, here's what you can be eating when you go out to eat, and here's maybe what you should look for shopping. And if you're not comfortable with shopping, maybe you should even look at buying groceries online. So those are the types of things that they walk through with the individuals, and also looking at their biometric data to say, okay, well, what's actually the problem other than just what your goals are? So where do we fit into that picture? Baptist Health asked us to look at the prevalence rate of metabolic syndrome within their population. The second goal is to look at clients across time and see what the programming that Baptist Health does what the effect is on their population or on their clients. And then the third goal is just overall, what can Baptist Health look at in their data to see like what trends do people have when it comes to metabolic syndrome? How can they focus their programming to help address those trends and be a little bit more focused to help treat people that they're working with? So now I'm going to let Brittany go a little bit more into the data and what we did as a program.
All right, thank you. So in order to start this process, we had to kind of see what kind of data we had access to. So the YHLCs have 4 different branched areas where they gain their data from. The first is from membership data systems, which pretty much are just when people come into the YMCA where they swipe in to indicate that they're in the YMCA. Then Baptist Health uses the Applied Health Analytics database system, which provides them a place to put all of their biomarker information, all of their demographic information, along with those personal survey information that Will previously mentioned. In addition to that, they use an attendance program referred to as Eventbrite. So this allows people who are interested in their programming to go ahead and sign up online for the programming. However, there's a little bit of an issue with this, as people can sign up and then not show up, or vice versa, not sign up and then choose to show up to the programming. So there are some discrepancies in who actually comes to their programs and who says they're going to come to their programs. Finally, they have access to those doctor referrals. So if a doctor suggests that a patient comes into them and goes to the YHLCs, they have the information regarding why they would want to go to the healthy living centers. For the purposes of our research, we decided to go and focus primarily on the applied health analytics information, which I'll go into a little bit more in depth here. So there were 3 main sections, as I mentioned. So the personal health survey data was over 10 sections, although for the purposes of most of our research, we didn't include the finances section, and that culminated in about 100 questions per client. In addition, we collected the biomarker information, which does include those 5 main risk factors that were mentioned, and then basic demographic information, which also includes personal and family medical history. So as we had mentioned before, we have 5 main risk factors, and one of those main risk factors is high waist circumference. And we ran into a little bit of trouble with this because only 134 of our 1,900 clients had given this information, which led us to a big question of how do we determine who has metabolic syndrome when we're missing one of those 5 key factors. So that led us to trying to figure out the best way to predict waist circumference, which took us down a couple different routes. So we first went and looked at past research that had suggested a way to calculate waist circumference using BMI, ethnicity, and age. Then we went down another route with a clustering model, which after a little bit of analysis we determined might not be the best route, which then led us to a regression model using the data that Baptist had. Once we had those 2 regressions, we decided to compare them to see which one was going to yield the most accurate predictions. And lo and behold, the regression model that used the Baptist data was the most accurate, and that is what we ended up using to determine waist circumference for our prevalence rates. So getting to the question of prevalence rates. So we can see here that in the sample we had about a 26% section that had metabolic syndrome. And this is actually fairly on par with the national average, which according to the CDC in 2012 was about 34.2%. And as Will had mentioned before, they do use the same risk criteria, so it is good to note that they're using the same kind of concept. Now you'll notice 26% is a little bit lower than the 34 for the national average. However, we have this additional 15% that's kind of in limbo. We weren't able to determine if they had metabolic syndrome because we simply didn't have enough information to make that assumption. So it's likely that some of that 15% would shift over to having metabolic syndrome if we were able to make that assumption. So next we have a map that's kind of illustrating overall the prevalence rates that we see. So the health zones are colored in green. The darker the green, the more people in that health zone have metabolic syndrome. In addition to the green shading, you'll notice that there are 5 pie charts, each in correspondence to a YHLC location. The green in the pie chart also is in terms of who has metabolic syndrome. So you'll notice that the north side area and the upper side is more has more people at those facilities and more people who have metabolic syndrome. So that kind of helps to show that where they are located is populations that are important to target. So then we wanted to kind of start to compare what's the difference between those with and without metabolic syndrome, and we wanted to look at their personal health survey data. So here you will see individuals who do not have metabolic syndrome. And for the purposes of this, 0 is kind of a threshold of like an average. If you're above 0, you have pretty good assumptions and good health behaviors according to your survey data, whereas below 0 means maybe not as good health survey sections, so you don't think you're getting enough sleep, you're not happy with your weight, things of that nature. So for these 6 sections, all of those without metabolic syndrome were above 0. And in addition to that, all of those with metabolic syndrome were well below 0. So we're able to see that not only are these risk factors being shown in the actual health risks that they're dealing with, it's reflecting in their personal assessment of their health behaviors. In addition to this, we did look at some of the other biomarkers and were able to determine that those with metabolic syndrome had a higher pulse, had higher BMI, and higher total cholesterol as well. So it was very good to see that these things are matching up and that people are aware that they're not doing as well when they actually aren't doing as well on their health assessments. So then we did have a smaller section of participants, about 130, who had come into the YHLCs multiple times. So we were able to compare how they did at time 1 versus time 2. So for this, we looked at their surveys as well, and we looked at how they did on those survey sections at time 1 to time 2. And for these survey sections, you can see that there is a change where all of these are going from lower scores to higher scores. So this is showing that people who are coming in on their second occurrence are reporting better health behaviors than they did on their first occurrence. Now, unfortunately, because we are not having programming information, we can't definitively say that the YHLCs are responsible for this great change, but it is good to see overall that people's health perceptions are changing. In addition to this, we wanted to look at those who may or may not have qualified for metabolic syndrome. So no one at time 1 who did not qualify for metabolic syndrome ended up getting metabolic syndrome by time 2. So that's showing that we're not getting people who are getting worse from the second time that they show up. So finally, we've looked across time, we've looked across non-metabolic and metabolic syndrome, and we kind of wanted to be able to give the YHLCs tools to help further make these predictions and to make easier assessment. So we performed a logistic regression to determine what other variables might help predict metabolic syndrome or indicate a likelihood of metabolic syndrome. So these 4 items, BMI, if you are a male, pulse, and if you're happy with your weight, indicate that you are more likely to have metabolic syndrome. So the bubbles you see here are kind of how much they can impact that probability of having metabolic syndrome. And so why is this useful for them? It can kind of help in twofold. It can help with their programming in general. So since BMI is such a large factor, focusing on things dealing with weight and healthy exercising are good ideas. And it can help on the personal level. So if you have somebody coming in with high BMI who is a male and you haven't gotten the rest of their biomarker information yet, you can kind of make a better judgment on whether or not they might be at risk. Or if they're like those people in limbo where we can't make it a definitive, we can kind of use these things as an easy guide for them. So our main conclusions. So first and foremost, the prevalence rate at the YHLCs and in Duval County overall is pretty on par with the national average. In addition, those without metabolic syndrome seem to be doing better both with health factors and survey scores compared to those who do have metabolic syndrome. When looking across time, we're able to see that people are improving in their survey scores from time 1 to time 2, and that no one is obtaining metabolic syndrome if they did not previously have it. And finally, at the top, we're able to look towards the future and provide information that can be used as a guide for their client. So this all kind of segues into recommendations we have after finishing up this project. So I'd previously shown you this graph to illustrate the different departments and different areas that they have data from. However, in reality, it looks a little more disjointed than that. So a lot of the areas of interest for this data aren't very well connected, and that's where some of our recommendations come in for the YHLCs. So first and foremost, tracking programming. So we have this wonderful data across time and we're able to show how people are doing, but we don't know what programs they are doing or how many they're doing. So maybe is it 3 programs and then you're doing better? What is actually affecting these changes? So being able to link that data to the biomarker data and the demographics that we have would be really useful. In addition, there were a couple changes we suggested for the survey sections. So as I had mentioned, the finance section wasn't used, but we know from past research that financial burden and financial stress do cause worse health outcomes. So including that survey data might yield some interesting results in those comparisons. And finally, for the survey data, again, there was no explicit question on if you simply do or do not have health insurance. And as we know, access to care is a really big thing, especially with these kinds of diseases. So knowing if they're able to go to a doctor on a regular basis could show us some differences as well. And finally, for recommendations with data, we talking about doctor referrals. So the YHLCs have these doctor referrals, but we aren't able to know who actually was referred versus who came in voluntarily. And this ties into the fact that we had about 400 missing cases in our original data set. These were people who had an identifier but no further information, which the wellness coaches probably said were people who signed up and then simply didn't follow through. And most of them came to the consensus they were likely people who were referred to by doctors who just decided that wasn't for them. So being able to actually prove that and say, yes, this is what was happening, could help them see who they should target better and who they should keep encouraging to come into their facilities. Finally, and our final recommendation is more on a line of communication. So the YHLCs are a really good midpoint between their clients and their doctors. So being able to give this information to their clients to help them understand what's going on with these different issues is very valuable, but on the flip side, communicating with their doctors as well, showing them the things they're doing that are non-medication based that can help these people, can really offer a bridge between a patient and their doctor. And thank you.